Hi, I'm Dr. Rajdeep More, consultant gastroenterologist, liver specialist and interventional GI endoscopist practicing in Thane. Today we are going to discuss about a very important and a very common disease that is called as gastroesophageal reflux disease, commonly called as acidity or acid reflux. So it is important to know what are the signs and symptoms, what are the reasons why there is increased acidity, and what can we do to prevent it or treat it. So here we have the food pipe, that is the esophagus, the stomach, and the first part of the small intestine. So the hydrochloric acid is secreted in the stomach. It has various functions like digestion of the food that we eat, as well as killing of the bacteria or the microorganisms. However, due to some factors, there is an increased level of acid production, which eventually ends up damaging the stomach as well as the lower end of the food pipe, leading to what we call as gastroesophageal reflux disease or acid reflux. So there are a few precipitating factors that we have to know, which can cause an increased level of acid secretion in the stomach. So most commonly are the irregular meal timing and irregular sleep habits, then unsupervised use of medications such as painkillers, as well as chronic smoking or chronic alcohol consumption is another very common cause of increased acid production, and a sedentary lifestyle and inadequate exercise or lack of physical activity can also lead to increased acid reflux and increased acid production. So now, what are the signs and symptoms that a patient can have because of acid reflux? So commonly patients do present with what we call as heartburn or burning sensation in the chest, some upper abdominal pain. There can be a bitter or sour taste sensation at the back of the throat. Patients can also complain of chronic dry cough. Commonly we have seen patients with gastroesophageal reflux disease wake up at night because of this dry cough, and so it is important to understand all these symptoms so that you are aware what acid reflux can cause. Now, what are the steps to treat or prevent acid reflux? The most important is, as we mentioned about the precipitating causes, is regular meal timings and regular food habits. Avoid anything which is very oily, spicy, deep fried, citrus fruits and juices, tea and excessive tea and coffee consumption. All these factors should be avoided. Daily regular exercise is a must to reduce the symptoms or to prevent acid reflux. Again, it goes without saying that the smoking and alcohol consumption should be stopped. That can help in relieving the acid reflux. And in spite of all this lifestyle management, if your symptoms still persist, then it is important to consider and seek professional help in the form of a doctor and undergo a procedure called as upper GI endoscopy or a gastroscopy. So in gastroscopy, what we do is a flexible tube is inserted through the throat into the food pipe, stomach and the small intestine, and the sites of damage in the stomach and the lower end of food pipe are visualized to assess and understand how significant the gastroesophageal reflux disease is. Depending on that, certain medications are started, but those have to be taken strictly under the supervision of your doctor and not self-medicate. So this is what I would want to tell you about gastroesophageal reflux disease. It is seen to be a very common problem, but it can severely affect your lifestyle. So if you have any such symptoms, do visit your doctor and seek the right help. Thank you.